Are you a family nurse practitioner or an adult gerontology primary care nurse practitioner? Do you currently work in a hospital setting or have been thinking about working in a hospital? If so, you will want to listen to this video. Hi, I'm John. I'm an acute care and adult nurse practitioner and a nurse practitioner scope of practice expert. I am frequently asked if an FNP can work in a hospital setting. In other words, is this within their scope of practice? The answer is not as straightforward as you might think. Scope of practice is partly defined by our respective boards of nursing and may vary from state to state. However, we are all obligated to practice in accordance with national nursing standards, and just because a board is silent on a topic or permits a nurse practitioner to do something, that does not alleviate us from practicing in alignment with national nursing standards, nor does it protect us from legal liability. APRN scope of practice changed when the consensus model was published in 2008. This national nursing policy gave us some key concepts regarding APRN scope of practice. First, our education, certification, and licensure forms the basis of our scope of practice. And second, scope of practice is based on the patient's needs and not their physical location. To answer the question, can an FNP or AGACNP work in a hospital, requires us to understand our scope of practice. FNPs and adult gerontology primary care nurse practitioners are educated, certified, and licensed to provide primary care to their respective patient populations. One of the main differences between these two types of NPs are the ages which they serve. Primary care is defined by the National Organization of Nurse Practitioner Faculties as an ongoing, long-term relationship between the NP and the patient, the provision of care for stable acute conditions and chronic illnesses, and the coordination of care that is beyond their expertise. So, if the care that the FNP or the adult gerontology primary care NP is going to provide in the hospital setting is consistent with primary care, then they may care for that patient in the hospital. A good example of this is the provision of palliative care. If the FNP or the adult gerontology primary care NP is providing palliative care to a patient in the inpatient setting, then they may work within the hospital setting. That is considered within their scope of practice. Palliative care is generally considered an overlap between the role of the primary care nurse practitioner and the acute care nurse practitioners. Another common example is an FNP that's working as a hospitalist for a hospitalist service. Many patients on a hospitalist service can appropriately be cared for by an FNP or an adult gerontology primary care NP. However, the problem comes in when the respective NP is caring for a patient who is unstable. For instance, a patient with hypercalcemia secondary to a malignancy who's experiencing an acute kidney injury and an altered mental status is considered unstable. The complexity and the instability of such a patient requires the skills of an acute care nurse practitioner, not the primary care nurse practitioner, such as an FNP or an adult gerontology primary care NP. I'm John again. I do one-on-one consultations. I hope you found this video helpful. If you have a question, reach out and schedule your consultation today.